Hello, I'm Alan Doherty from the Focal Therapy Clinic. I'm a consultant urologist specialising in prostate cancer treatment with more than 25 years of experience helping men understand their options and make informed decisions about their care. I'm often asked by patients when they've decided to have a treatment if they can do anything to improve their outcomes. So I look at the patient and I say, you've come to me to essentially be cured of prostate cancer because you want to live longer. And very frequently, a patient just doesn't look very healthy. They haven't looked after themselves. And I think, okay, so you want to live longer by me curing your prostate cancer, which probably wouldn't have killed you for at least another 10 to 15 years, but you're overweight, you've got high blood pressure, you're diabetic, you're not looking after yourself, you're not eating properly. Those things are much more likely to affect your longevity and quality of life. So I sometimes point out the obvious, which is you really need to get fit, look after yourself in terms of what you eat. And those things are actually very difficult to do. And you need to be very motivated. Now, most patients when they have cancer want to get on with the treatment. So the months and months that it would take to change their general health and is probably too long for them or for me to defer the treatment until they've done those things. So in reality, as long as patient is fit for an anaesthetic, they don't do the things that they should do to make it beneficial. In other words, to make it worthwhile treating their prostate cancer. Then the question is often asked, well, what about my pelvic floor? Should I strengthen these muscles so that after treatment I'm not incontinent? And my view on that is that, particularly with surgery, if the surgery is done to a high standard, you shouldn't be damaging the pelvic floor. And if the pelvic floor is healthy before the operation, it should be healthy after the operation. But it is true that there is evidence to suggest that doing pelvic floor exercises before an operation is helpful. And I suspect that's partly because some surgery can damage the pelvic floor, so the stronger the pelvic floor is before the operation, the better. But usually the amount of time between the decision to treat and the treatment is relatively short, and probably too short to make a big impact on the strength of the pelvic floor by doing pelvic floor exercises. Having said that, if you learn to do it before the operation, then you can start doing it more effectively after the operation. So I am a fan of people learning to do these techniques beforehand. I am a fan of patients, I suppose, realizing that the prostate isn't everything, it's their general health that is equally important. And I think often patients realize that they haven't been looking after themselves enough. And it's amazing how often I see patients after their treatments suddenly looking after themselves and suddenly feeling better, looking better, and hopefully living longer. A prostate cancer diagnosis can feel overwhelming, but you don't have to navigate it alone. Our team is here to help you understand your options and support you in choosing the treatment that's right for you. Visit the Focal Therapy Clinic to find out more.